Hi, I'm Dr. Anjali, consultant pulmonologist at Hosmat Hospitals, Bangalore. So today the talk is regarding how to keep your lungs healthy, specifically during this monsoon season. Your breathing is something which we always take for granted because we do it involuntarily throughout your life. So unless and until there is some problem with your breathing, you don't realize how your lungs are functioning. So your lungs mature by the time you're around 20 to 30 years old, and beyond the age of 30, your lung function gradually declines with age, and this can make breathing slightly more difficult as you get older. Now, how to improve your lung function? I'll put it under three headings. One is lifestyle modification, the other is specific protection and prevention of infection, and the other one is awareness regarding the warning signs that your lung can give. So, regarding the first part, which is the lifestyle modification, these are all things which you know: regular exercise, good nutrition. So, coming to exercise part, how much should you exercise? So, as per the guidelines, it is recommended that adults should get at least 30 minutes of moderate exercise for at least 5 days a week. This can be your aerobic exercises like walking, running, jogging, and also your muscle strengthening exercises such as Pilates and strength training. As you all know, exercise helps to increase the strength of your muscles. It improves the strength of your bones. It gives you mental relaxation. It reduces anxiety and depression. So, along with that, regular exercise also helps to improve the strength of your respiratory muscles as well. These are the muscles which aid with your inspiration and expiration. Regular exercise, when you do it on a regular daily basis, it helps to improve your cardiac muscles as well as your respiratory muscles. So, in breathing exercises, there are two types of exercises which we recommend. One is pursed lip breathing, and the other one is belly breathing. In pursed lip breathing, it reduces this particular type of exercise. It reduces the number of breaths you take per minute, and it keeps your airways open for a longer time. So here you simply breathe in through your nose and breathe out with pursed lips. So basically, it is so this is what you do in pursed lip breathing. The other one is belly breathing, which ideally you can do it by lying down. So that becomes easier. So before you get up in the morning, or once you go to bed in the evening, you can start doing this belly breathing or diaphragmatic breathing, where you can keep your hands on your belly and take a deep breath and exhale out for almost twice as long as you're breathing in. So it's basically so your exhalation becomes more in duration than your inspiration. So when you start doing an exercise, always if you have a lung condition, it is always better to consult your doctor. And if you are somebody who's suffering from any chronic lung diseases such as lung fibrosis or even asthma and COPD, you can always consult your doctor, have a personalized exercise plan set out for you so that it doesn't become overwhelming for you when you start doing exercise. Even otherwise, even if you are a completely healthy person, it is always better to get certain cardiac as well as respiratory uh, functioning tests done. Next thing is obesity, which, as you all know, it contributes to a lot of health issues, including that of the lungs. So people who are obese, especially if they have asthma, it is very difficult to control the asthma. Obese people who are asthmatics, they require more medications. They have lot more worse symptoms, a lot more exacerbations. So poor asthma control over time can lead to airway remodeling, which is again a feature which reduces your lung function on a permanent basis. Another thing is obstructive sleep apnea. It is a risk, again, obesity or being overweight is a risk factor for sleep apnea, where your saturation drops when you're sleeping, and this on a long term can cause a lot of side effects. There are also things called as obesity hypoventilation syndrome, where you don't breathe as much as you are required to breathe. The next thing is to avoid smoking, both active as well as passive smoking. Cigarette smoke, as you all know, is a leading cause of cancer and chronic obstructive lung disease. So cigarette smoke can narrow your air passages, it can make breathing difficult, it increases the inflammation in the lungs and causes excess mucus production. And over time, cigarette smoke destroys your lung tissue and trigger changes that can later on turn into cancer. So if you smoke, the right time to quit is now. It's never too late to quit smoking. Once you quit smoking, it takes a lot of time to get the lungs back to normal. It might not even be your baseline normal. To reverse the changes, it is going to take a lot of time. So the right time to quit is now. There is nothing called as reducing the number of cigarettes. The only thing that you can do is to completely stop smoking, and converting into e-cigarettes as a part of quitting smoking is again not advised. It is not FDA approved mode of quitting smoking. E-cigarettes also contain harmful chemicals and juices that do the same thing as what cigarette smoking can do. And the next one is indoor air pollution. We might all think your house is all clean, then there's not much pollution as long as you keep your windows closed. But then there are things that you use at home, like first thing is again secondhand smoke. The other chemicals that you use, like the agarbatti, the dhoop, these are all cause of indoor air pollution, and these also increase respiratory illnesses amongst all the people living in the house. Next part of this talk is regarding disease prevention and specific protection against specific diseases. So, when it comes to disease prevention, there are multiple general measures which we all know. We all learned it during the pandemic. So, the first thing is to wash your hands with soap and water. If soap and water is not available, use a hand sanitizer and avoid crowds during the cold and the flu season. Maintain good oral hygiene. Brush your teeth at least twice daily because there can be micro aspirations which can later on develop into pneumonia. And if you get sick, stay at home. Make sure that you don't pass on the disease to others. Regarding specific protection, the most important things right now, which all doctors advocate, are the vaccinations. There are vaccinations available, like against COVID, there was vaccination. There are vaccines available against influenza, which is your regular flu, and against pneumococcal pneumonia as well. So these are to be taken by all patients who have any sort of a chronic disease, like even diabetics, heart patients, people who have asthma, lung fibrosis, all these people are required to take these vaccinations after consultation with your regular healthcare provider. Next part is awareness regarding the signs that your lungs are giving out to you. The first one is chronic cough. That is a cough which lasts for more than 8 weeks, or even if it is more than 2 weeks, if it is persistent, always make sure that you go to your healthcare provider and get it checked. Shortness of breath. So if you are exercising, it is normal to have a shortness of breath. But if it is lasting longer, even if after stopping the exercise and resting, then you need to go to a doctor. The third one is chronic mucus production. So mucus of phlegm is the substance that is produced by your airways as a defense against infection or irritants. But if your mucus production is lasting for more than a month, then it is better that you go to your healthcare provider. The fourth one is wheezing. So, wheezing or noisy breathing is a sign that something is blocking your airways. Coughing up blood or vomiting of blood, whether it's coming from your lungs or it is coming from your gastrointestinal tract, it is not normal. You definitely need to get it checked. Chronic chest pain. So when it comes to lungs, non-explained chest pain, especially if you get pain when you're taking a deep breath, all these are suggestive of things which need attention. Now it's the monsoon season. In monsoon season, there's always a lot more lung issues. So in monsoon season, there's a lot of pollen, there's dampness in the environment which increases the mold, there's house dust mite. So all these are causes of allergies. So we always see a lot of flare up of allergies. So always make sure you use the precautions to reduce your allergy flare ups. Stick to your medications, go to your doctor, get your medicines titrated accordingly. Some of you might be on immunotherapy also. So go to your allergy specialist if you have allergies and get your medicines properly prescribed. And if you're an asthmatic, these seasonal changes can cause a lot of flare-ups and exacerbations. So do not step down on your medications. Be regular with your regular inhalers and other asthma medications. Apart from all of this, there's a lot of viral infections, respiratory infections which increase during monsoon, which is again a cause of flare up of your respiratory diseases. Now, coming to commonly asked questions by patients. So, most commonly, many patients do ask me if allergy and asthma have a hereditary predisposition. Definitely, yes. If your first degree relative, that is your parents or siblings, have asthma or wheezing, then there are very high chances that you can also have asthma. And many ask if asthma can be completely cured. Asthma is not exactly a completely curable disease, but with regular medications, you can definitely keep it under control and have a very good quality of life. Another question is regarding smoking, how if stopping smoking can reverse the lung damage. To an extent, it can, but it will take a long time. It will depend on how many cigarettes you have smoked, how long have you been smoking. So, depending on all of that, some amount of baseline improvement can happen, but coming back to your regular normal baseline is again difficult. So, the earlier you stop smoking, the better it is.